The concern that I have, though, is that we're getting a bipartisan rhetoric, but we're not seeing any actions. Right now, the House is still trying to jam through this current health care bill. And so if you want real bipartisanship, that means the party in power has to be willing to legitimately collaborate with the minority party. And we really don't see that in substance and in action. And we really do have a huge problem with this health care bill they're trying to jam through. And so the architecture of this health care bill, which we believe represents a government takeover of the health care system, we had to scrap that, start over, and then let's go down the list of fixing the problems that need fixing. Uninsurable, people who have pre-existing conditions, making healthcare more affordable. I think there is a bipartisan pathway to get those things fixed, but this government takeover of the healthcare plan, that to me is not the right answer.
Well, they would say to you that it's not a government takeover, that in fact there is no public option in either the House or the Senate bill. So where is the government takeover?
Because what this bill does, whether it's the House or the Senate bill, the federal government takes over the states' rights in being the single regulator of all health insurance. And what it does is it creates a new entitlement and a new subsidy within the exchange, which puts everybody on a plan that is run, regulated, and designed by the federal government, not by the states, not by the markets, but by the federal government. And also our new bureaucracies being put in place by this bill, which effectively, in our estimation, puts the government in charge of really regulating and running health care.
Do you think, and I know we've got a little bit of a delay here, so I want to apologize to folks, but we're trying to get the facts out here and clarify some things that have been misunderstood. But do you think that Republicans, your colleagues, want the issue, or do they actually want to get some of these individual pieces of health care done? Which is better, politically and substantively?
I want to get these individual pieces done. My belief is good policy is good politics. And this is why go ahead.
No, I was going to say you go ahead.
My belief is good policy is good politics. And that's why my colleagues and I have offered lots of different ideas on how to tackle these problems. Basically, Andrea, what I'm saying is let's fix what's broken in healthcare without breaking what's working in healthcare. And many of us have offered comprehensive solutions to getting insurance to the uninsured, affordable insurance to people with pre-existing conditions, bringing down cost in healthcare, and doing it without having the government take it over, without breaking the bank. We already spend more than 2.5 times per person on healthcare than any other country, Andrea. Let's spend the money we're already spending more efficiently, more effectively, than creating a new entitlement, which when it's fully implemented costs $2.5 trillion, which we do not have, all on borrowed money. You cannot literally tax and Medicare cut your way to paying for this new entitlement. And so we see this thing as a fiscal train wreck. We see it as unnecessary, and we think there are ideas. I talk to people like Ron Wyden over in the Senate, a Democrat, other people who put out good ideas out there that I think could form the basis of bipartisan compromise. But those aren't the kinds of Democrats running Washington right now. That's not the kind of bill they're trying to pass through Congress these days.